All right, we're about to take a pretty incredible journey. Inside our own bodies, we're heading into the complex, hidden world of our digestive system. And we're going to see how doctors basically become detectives, using a very special kind of X-ray to map out our insides and find clues to what might be going wrong.
So let's just start with the big question, right? I mean, how on earth do you do that? The gut is this long, winding tube all packed together inside of us. You can't just peek inside. So how do you get a clear picture of what's really happening deep down in there?
Well, the answer is actually pretty clever, and it involves two key things. First, you've got the familiar X-ray. But, on its own, an X-ray can't really see the soft tissues of the gut all that well. That's where the second, much weirder ingredient comes in. A thick, chalky drink that's going to create a perfect outline of our entire digestive tract. And that brings us to the real hero of this whole story. It's the key substance that makes this entire investigation possible. It's not a new machine, but a simple element that completely changed the game. Let's talk about the barium breakthrough. So that chalky milkshake is what's known as a contrast medium, specifically barium sulfate. Just think of it like a special dye, but instead of adding color that your eyes can see, it adds contrast that an X-ray machine can see. It makes things pop.
And here's the really simple genius behind how it works. Barium sulfate is super dense, so dense it physically blocks X-rays from passing through it. So when you drink it or get it as an enema, it coats the inside of your digestive tract. Then, on an X-ray, everything the barium touches turns bright white, creating this perfect silhouette, a literal map of your gut for doctors to read.
Okay, so let's start with the first method of investigation. We'll call it the top-down approach. This is a journey that starts in the stomach and works its way, hour by hour, through the maze of the small intestine. The official name for this is the small bowel series. And what are our detectives looking for with this one? Well, it's usually one of three things. Inflammation, which could be a sign of something like Crohn's disease, neoplasms, which are abnormal growths, and obstructions, basically any blockages that are stopping things from moving through like they should. All right, the clock starts now. The patient has had their barium drink, and just 30 minutes later, we take the first picture. You can see it right there. The bright white barium is filling up the stomach, and it's already starting to make its way into the first part of the small intestine. The journey has begun. Fast forward to 1 hour in. Now you can see the barium has moved almost completely out of the stomach. It's deep in the coils of the jejunum now. That's the middle section of the small intestine. The path is getting longer and clearer, and doctors are watching its progress every step of the way. And here we are, 2 hours after the drink. The barium has reached the ileum, which is the final section of the small intestine. See, by taking pictures at these specific times, radiologists create a full dynamic map of the entire small bowel. They're not just seeing its shape, they're watching how it works over time. But what if the problem isn't in the small intestine? What if the doctors need to get a good look at the large intestine, or the colon? Well, for that, you need a totally different angle of attack, the bottom-up investigation, which is known as the barium enema. Whoa, okay, look at that list. P-A-R-A-O, L-A-O, decubitus. It looks incredibly complex, almost like a secret code, right? These are all just different positions the patient has to get into so the team can get a complete set of X-rays. So why all the gymnastics? There's a really important reason. You see, the colon has all these sharp twists and turns, and those are perfect hiding spots for small problems like polyps. So by taking pictures from every single one of these angles, doctors create a true 360-degree view. They make sure no shadow, no fold can hide a clue. It's that level of detail that makes it so powerful. Let's actually see what that looks like. Here's the RAO position. The patient's lying on their stomach, rolled just a little bit to the right. And look at the image it creates. This angle gives us a unique view that highlights a specific curve in the colon that you would totally miss in a simple, flat front-on shot. Now, for the LPO and RPO positions, the patient is on their back, rolled left or right. And, as the slide says, these specific angles are designed to open up those sharp corners. Imagine you're trying to read something written inside a folded piece of paper. You have to unfold it first. That's exactly what these positions do for the colon. It lets doctors peer into every single nook and cranny. And finally, a simple lateral view. Just a shot from the side. This gives a perfect profile, which is absolutely critical for getting a clear look at the very end of the line, the rectum and sigmoid region. You see, every single position has its own very specific and vital job to do. So we've seen the two main investigation techniques. We followed the barium top-down
and we followed it bottom up. Now it's time for the payoff. What does all this work actually reveal? What kind of evidence are the doctors looking for?
It really comes down to using the right tool for the right part of the job. The small bowel series, that top-down journey, is perfect for finding problems in the long, coiled small intestine. The Barium Enema, on the other hand, is the gold standard for checking out the large intestine for things like polyps or other changes to its lining. And what they can find can be, well, pretty incredible. Sure, these barium silhouettes can show doctors tumors and blockages, but look closely at this image. This is from a small bowel series. Do you see those thin, dark lines kind of floating inside the bright white barium? Yeah, that's a 12-inch parasitic roundworm, perfectly outlined by the contrast. An unwelcome secret totally revealed.
So when you put it all together, the verdict is pretty clear. Barium studies are just a remarkably clever and non-invasive way to solve a really difficult problem. They take this invisible, twisting, hidden world inside of us and turn it into a black and white map that doctors can actually read, analyze, and use to figure out what's wrong.
It really is an elegant solution that has helped so many people. And it kind of leaves you with a final thought, doesn't it? Barium studies were a huge leap forward. So with today's technology advancing faster than ever, what incredible new windows into the human body are we about